dysfunction, premature ejaculation, fear of performance, low libido, and associated with diabetes, blood pressure, and overweight, and sometimes with relationship issue. Loss of early morning erection, again cause of organic, maybe you have to rule out with a penile Doppler test. Now you know psychogenic cause, organic cause, perivascular cause, and infection cause are associated comorbid diseases like diabetes, blood pressure, and so on. In case of male sexual problem, sometimes hypogonadism is a common, and undescended testes, patient comes to you. Nothing can be done after in puberty, particularly testes is almost dead in the abdominal cavity, so that their heat is more. And such cases you can try non-conventional treatment like what I am using in my center is homeopathic most of the time. Sometimes helps, sometimes may not satisfactory. In some other remedies in homosexuals also used, but these remedies are helpful in the bisexual patient can have interest with the partner, male, female, opposite partner particularly, and not successful rate so far in heterosexual, actually in particularly exclusively homosexual, exclusively homosexuals. Remember, my dear friend, this is a terminology you should know being a sexologist. Sometimes you feel this is what is the use of this knowing, but this is very important things. Management, correction of any organic etiology factors, endocrine, vascular drugs, metabolic, neurological disease, local lesions, and alcoholism. Alcoholism is must stop the alcohol. We will help you. We will give the assignment in last because already we are reaching to the end of today's program. Just we go ahead and dual testocap. Most of the time patient feel that way. No, don't worry, sir. We can have the oral testosterone therapy. Then you have to give the 40 to 120 mg particularly, but it is a costlier sometimes. And dual testocaps, 40 to 120 mg per day with a fatty food. And otherwise you can have the testosterone injection I told you twice in a month for 4 to 6 injection is sufficient. Most of the cases don't need more. But 2 to 3 months treatment is more than sufficient. 3 months treatment. Preparing ejaculation without part. Okay. First, these are the things, stop and flow techniques. First step, second step, ejaculatory stage, how to control it. I explain you. Stop and start technique. We told the patient mostly whenever he passes the urine, male part get ejaculated and stop and flow. Urine passing control. Most of the time patient make the mistake that they control with they press with the hand penals. No need. Just meters means just contract relax mentally, not by physically, by hand. Squeeze technique I explain you. Lifelong PE is the best treated with SSRI, depoxetine 30 mg. I told you paroxetine 20 to 40 mg. Adverse effects are usually minor fatigue, sticky nausea. These are the common, and acidity is common. Retarded or absent ejaculation. These are again common. Patient comes to you. Is less common and has even comes to you. Is less common and has several possible organic causes. However, it may be caused entirely by psychological or emotional factors. that are amenable of behavior therapy and psychotherapy. I have the one retarded, just I treated. I asked, he never said ki I am taking a psychiatric medicine. He said ki you are the sexologist, don't know, no need to mention. I asking him, never said. But later on he said, sir, I have some medicine I am taking on schizophrenia and all. And such type of patient, retarded or absent ejaculation is very common. Sometimes even there is no disease, they have such type of absent ejaculation. They do the ejaculation in masturbation very well, but here they need the psychological counseling and these things. Retrograde ejaculation, you know better whenever there is surgical interventions which occurs after transurethral resection of the prostate and all. Delayed ejaculation is very common again. Most of the time patient comes. Failed emission can occur due to the spinal trauma and surgical procedure such as radical prostatectomy. These are elderly age group particularly. Inhibited ejaculation is the psychological variant of delayed ejaculation. Ejaculation usually occurs rapidly with solitary masturbation but not during intercourse. A variety of psychological factors may be responsible, including fear of pregnancy and other things, guilt and repressed hostility toward the partner. So, inhibited ejaculation, someone will come, they first doing the act and all, the inhibited ejaculation. Okay, fine. These are the various terminology used. The male ejaculate problem, premature ejaculation, retarded ejaculation, absent retrograde ejaculation, delayed ejaculation, inhibited ejaculation. Painful ejaculation can be caused by acute genitourinary infection. Sometimes patient having some infection. Along with this, fungal infection surrounding this, also you take the care. Each and every one you must observe by keeping distance. Just observe and advise accordingly. If there is black coloration and all, and there is itching, just give them these things, antifungal ointment and application and powder, mycoderm powder application. Ejaculation incompetence, here there is a failure of ejaculation during intravaginal containment. These are again the patient for that. Sir, I can do, but I can't perform, I can't ejaculate inside the vagina of the patient, so that there is a problem. We had to advise others remedy for this fertility point of IVF and other things. In such cases, you can try, instead of squeeze technique, as the case of premature ejaculation, the female partner is advised to manipulate the penis to force ejaculation. Masturbation method may be used to avoid the penile irritation. It may take few days to accomplish this. Latter rapidly intromission of the penis should be accomplished by the wife in female superior position. Female should be superior and thrusting attempted. Here male is not, female is superior position, and try these techniques. Advice, if possible is okay, otherwise infertility centers, refer to infertility center if any fertility issue. If the male still does not ejaculate, the wife should end the coital connection and restore a manual stimulation. As the husband, now conditioned to manipulatory response reaches the stage of ejaculatory control, he should inform his wife. She should remain in the female superior position while the manipulating the penis, and from the position advantage quietly reinsist the penis into the vagina. After 3 or 4 such attempts, confidence is in intravaginal ejaculation performed will have been achieved. Such type of cases, you can try other techniques and methods if possible. If not, then better to have other modality. May use homeopathic and other things. If they have the response within a month, then you continue, otherwise stop it. Now,